My name is Dr. Debra Wilson. I'm a general practitioner and my husband and I have 3 daughters. My qualifications include a Bachelor of Medicine and a Bachelor of Surgery through the University of Auckland. I have a postgraduate diploma in child health and a certificate in women's health through the University of Otago. I'm a fellow of the Royal New Zealand College of General Practitioners. My submission is in opposition to the Conversion Practices Prohibition Legislation Bill. These are my significant concerns in regards to the proposed bill. As a practicing doctor, I've always conscientiously objected to filling prescriptions for puberty blockers and cross-sex hormones for individuals below the age of 18 years. I'm concerned by the lack of evidence to support puberty blockers and cross-sex hormones for youth. I find it difficult to believe a youth can fully comprehend the implications of this treatment, including impact on future fertility, health risks associated with such treatments, and potential for future regret. I understand the High Court of England and Wales ruled that under 16s were unlikely to be able to consent meaningfully to taking puberty blockers, and a later ruling allowed treatment only with parental support and consent. Recently, I see this ruling has been overturned. However, it still raises the question if teens with evolving identities are able to make informed consent for such treatment. I also understand Sweden's Karolinska Hospital changed its protocols in April this year, putting a stop to initiating youth on puberty blockers and cross-sex hormones, with the only exception of being above the age of 16 years and involved in a clinical trial. I find it very concerning that the government wishes to pass a law to make it a criminal offence for parents who decline puberty blockers for their children. This bill also inhibits religious freedom in New Zealand. I'm in agreement that there should be no coercion or manipulation for youth who express differing gender identity or sexual orientation. However, if a youth were to seek guidance or counselling or prayer in regards to gender identity or sexual orientation, in keeping with their religious view, then they should be free to do so. And if they are able to seek therapy to change from heterosexual to homosexual, then they should be allowed to do the opposite. As a practicing Christian, I also believe it is important for faith communities to have freedom to teach and explain core values and beliefs. This includes teaching on gender identity and sexuality. My personal Christian belief is that love, compassion, and respect be given to all people, regardless of sexual orientation or gender identity. Thank you.
Thank you very much, Debra. Thank you. Just checking if we've got questions from other members. I think we have one from Lawissa Wall.
Kia ora, Debra. Thank you for your submission. Just highlighting the judgment in the UK. So it went to the Court of Appeal, and essentially they've put the responsibility on people such as yourself to determine whether anyone under the age of 16 has the ability to give informed consent. So the power lies with the GPs and with the medical profession, which I agree with. And also, in an ideal world, that young person would have the support and consent of their parents. So how does this bill stop you from being able to do that and practice as you currently do?
I am probably wanting to see the bill more supportive of the parents involved in the decision making. And I am probably more in favour of recently what Finland have advised in supporting psychotherapy as frontline treatment. And I think there needs to be more high quality clinical research in this field, probably before we make affirmation sort of therapy in the way of starting puberty blockers and cross-sex hormones as first line. I think there needs to be good high quality research first.
And can I just understand from your perspective the process, because I've looked at the Mental Health Foundation. They've got a whole section on gender dysphoria, and they talk about the first point of call should be a GP such as yourself, and then you refer to a specialist. And from their perspective, they're psychologists, psychiatrists, mental health practitioners, clinical social workers. I mean, they would be the ones that would do exactly what you've just said, isn't it? Provide that therapy.
Yeah, and I think like if a family with a child were coming and requesting the referrals, I will do as they've requested. I probably just don't feel comfortable with the current research from what I've looked into to fill those prescriptions. Like I don't feel at the stage. However, I do want to say, Louisa, that I have been through the process with an adult, and I was comfortable that they fully understood the treatment, and they were able to consent, and they'd seen a psychologist, and with the support of a specialist, I put them on the treatment, because I very much see myself as journeying with someone, and like my beliefs, and it's really important my beliefs don't influence their decision. I'm there to journey with them, but I just have concerns around the consent and the evidence, medical evidence for under 18s. Thank you.